Almost forgot.
Well, hello, everyone. We're just going to give everyone a couple of minutes to get situated, get connected, and then we'll get started.
That's
We'll just give it one more minute before we get started, but if everyone could just mute their mics, we would greatly appreciate that. Thank you. I think we can go ahead and get started. Dr. Bella, would you like to start us off? And you're on mute, by the way.
Absolutely, I would. I want to thank everyone for joining our informational webinar on Cycle 2 of the AMA Foundation's National LGBTQ Fellowship Program. Before we get started, I want everyone to look across the panel at the huge smiles. We are so proud. We are so excited to be starting Cycle 2. And I would like to introduce myself and then call on the AMA Foundation staff and fellow team members on our fellowship commission to do the same. Again, welcome. I'm Jacqueline Bello. I am a former president of the AMA Foundation and perhaps the newest member to the Fellowship Commission in charge of the LGBTQ Fellowship. It is such a pleasure to be celebrating Cycle 2. I am a neuroradiologist by trade. As a radiologist, I have launched an initiative inside of radiology known as Radiology's Health Equity Coalition. And I can't tell you how proud I am of this effort that is an important part of health equity. Next, I'll ask the staff to introduce themselves. Sandy, followed by Emily, followed by Faith. Thank you.
Thank you, Dr. Bello. My name is Sandy Smith. A lot of you have probably heard from me. You get my emails pretty frequently. I'm glad to see so many of you here today. I will be happy to help you throughout the process. I'm the Director of Development and Principal Gifts with the AMAF Foundation, and I'll turn it over to Emily.
Hi, everyone. So good to see all of you here today. I'm Emily Demko. I am the Program Manager at the AMA Foundation, so I oversee all of our programs. Faith, over to you.
Thanks, Emily. My name is Faith Bitterman. I am the Program Coordinator, and I work mostly on the LGBTQ Fellowship Program. Just like Sandy, I'm happy to answer any questions you may have throughout this process, but we're just happy to have you all on this call. Thank you. Dr. Bella, back to you.
Thank you. Next, I'd like our commission members who are in attendance to introduce themselves. Joshua, followed by David, Richard, and Kim. Thank you.
Thanks so much, Jay. I think there's actually two Kims on the line. So I think Kim Templeton just joined as well. So we've got a lot of our commission members here, which is great to see. I'm Josh Cohen. I'm also a past president of the foundation, and I'm also the founder of the LGBTQ Honor Fund, which led to the funding of this fellowship program. So I've been involved with this project since 2013, and I'm really excited to kick off Cycle 2, and thank you all for being here.
Hello, everyone. I'm David Brown. I'm the Associate Dean and Associate Vice President for Health Equity and Inclusion at Michigan Medicine. I'm also a pediatric otolaryngologist or ear, nose, and throat surgeon. And I'm one of a group of people who designed a health equity curriculum at Michigan Medicine for all of our residents for health disparities for all types of marginalized individuals. Welcome.
Hello, everyone. I'm Richard Marfuji. I am a plastic surgeon by trade, but I have had the pleasure to work with these wonderful people and have recently joined not only the commission here, but also Emily's leadership development program. And I am the academic director of the National Student Leadership Conference on Medicine and Healthcare. And one of my missions is to bias pre-medical students, even students before they get to college, on the advantages of health equity and the necessity for that. So I'm so proud to be part of this whole endeavor.
Hello, everybody. I'm Kim Hunt. I run an initiative under AIDS Foundation Chicago called Pride Action Tank, which is a project incubator and think tank on LGBTQ issues. Very happy to be a member of the commission and thrilled to see all of this interest here in this second cycle. And I will turn it over to my fellow Kim commissioner.
Thank you. I'm Kim Templeton. I'm an orthopedic surgeon at the University of Kansas in Kansas City and past president of the American Medical Women's Association and past chair of the Sex and Gender Health Collaborative. So I'm honored to be a member of this group and to work with this awesome group of people. I try to bring in the things from the perspective of a sex and gender lens as we're looking at LGBTQ+ issues. Thank you.
Thank you. And have I missed any other fellow commission members, Kim or otherwise? If not, thanks again for joining. I'm going to turn it over to Sandy to get us started. Thank you.
Thank you, Dr. Bello, and thank you to all the members of the commission who graciously gave their time to be here today. Before we dive into the application RFP itself, I'm just going to give you a brief overview of the AMA Foundation, just to give you some general background. So the AMA Foundation is the charitable arm of the AMA. The AMA is the largest physician-based association in the country. The AMA Foundation is a separate 501c3, and we serve our donor community as well as patients across the company. You can see our mission on the screen in front of you. So we have three main programmatic buckets. First is medical education and leadership. That's where this LGBTQ fellowship falls. We also have a scholarship program that dates back to the very beginning of the foundation. We award $10,000 scholarships to rising final year medical students. We also have the Leadership Development Institute that Dr. Marfuji just mentioned. Again, for rising final year medical students, so they can get education and training and other development so they can become leaders in organized medicine. We also have our community health program. We have our physician-led community programs throughout the country. They are designed to help the underserved communities in the prevention and management of type 2 diabetes. And then finally, we have our Excellence in Medicine Awards, whereby we recognize the outstanding efforts of medical students, residents, and then career physicians for a variety of categories every year annually at the June meeting. With that, I will turn it over to Dr. Cohen.
Well, thank you so much, Sandy. And as many of you know, there's an enormous gap in care for the LGBTQ+ community. So I wanted to kind of lead you through the problem a bit and why we ended up with this fellowship program. So there are a multitude of studies that have illustrated the healthcare disparities that members of the LGBTQ+ community face. And a startling 20% of LGBTQ+ adults forego medical care altogether for fear. And this is a problem that really, really needs to be addressed. There's also a huge lack of instructional time dedicated to the unique healthcare needs of the LGBTQ+ community in medical education, wherein on average, medical students receive less than 5 hours of LGBTQ+ focused education. So with that, we knew that there was a need for a national program. Some of the data points that underscore that are on the screen right now. We recognize that developing an LGBTQ+ affirming healthcare curriculum and recruiting a pipeline of trained physicians to reduce those healthcare disparities would be really essential to addressing this problem. A survey that was done on medical students found that LGBTQ+ individuals face direct and implicit bias when receiving care, and when surveyed, only 12.9% of medical students passed the test assessing medical knowledge relevant to treating LGBTQ+ individuals. So through this fellowship program, we hope to address the need and close that gap in healthcare inequities for the community. So Dr. Bello will lead you through this program, specifically both its goals and its purpose.
Thank you, Joshua. Simply put, our vision is that all LGBTQ+ patients will be treated with the highest standards of care, empathy, and dignity, while having access to the best possible outcomes. And listed across the top of the screen are our goals: to enhance physician training, closing the gap in disparities, and convene stakeholders on a national level, create and cultivate institutional leaders. We are looking for a multiplier effect here, and develop and share the standards of care and best practices. Finally, these best practices I spoke about sharing are intended to have the result of increasing competencies across the continuum of medical professionals working with LGBTQ+ populations, decreasing the barriers as mentioned. And for an overview of the program, we want to shape the future of LGBTQ healthcare, supporting dozens of institutions and fellows in the coming years, convening groups to really move the needle in LGBTQ health, equity, and health care, forming a community of leaders in this space. And finally, but most importantly, to sustain this fellowship in perpetuity through endowments to support training doctors to serve more and serve better this LGBTQ+ population. And to quote our current president, Heather Smith, demonstrate commitment to fostering health equity, reducing disparities. It's a transformative program for investing in affirming and inclusive patient care, embedding equities at all levels of leadership, analyzing the data so that it can be funneled back in to the development of high standards of care. I'm going to turn it over now to Sandy and Faith to go over some of the details of the fellowship program.
Thank you, Dr. Bello. And so as you can see on this screen in front of you, our goal is rather than fund fellows at scattered institutions across the country, this LGBTQ+ fellowship program is designed to bring people together. Fellows, institutions, experts, partnering organizations, medical students, and eventually other invested stakeholders. And so we will do this through presentations at national conferences, research opportunities, through that sharing of the curriculum and standards of care as we build it over time, built-in mentorship and leadership development, not only for the fellows, but other faculty and individuals across the institution. We want to build an online community and archive of resources so that people have a place to go for other best practices and information related to LGBTQ plus health and healthcare, and then offer extended program support along the way. As it relates to the grant itself, the structure is on the screen in front of you here. So the grant is for a total of $750,000 over a total of 4 years. The first year is a year of program and curriculum development, followed by 3 years of fellowship training. Eligible institutions need to have at least one graduate medical education program and be fully licensed and accredited. And you can see most of the things on the screen I just spoke about, but the goal is to create a real program, not just fund fellowship training. And so in doing that, we hope the institution will build capacity as well as train fellows and inform other areas of their work. And now I believe we turn it over to Faith to go through the nitty-gritty details.
Thank you so much, Sandy. So now I will introduce a little bit more background on the Fellowship Commission, the selection committee for the fellowship program. So the Fellowship Commission on LGBTQ plus health was created to provide leadership and help guide the foundation through the fellowship program. The commission helps oversee the development of the request for proposal, or RFP, and the long-term programmatic framework of the fellowship program. The commission serves as the direction for the foundation and ultimately recommends the grant recipient for board approval. The commission was strategically designed to include members from all across the nation, and their background includes a variety of areas of expertise, including academia, medical professionals, advocacy, philanthropy, and other professional occupations that support the LGBTQ plus community. And so on your screen are members of the Fellowship Commission, some of which have joined us on this. The AMA Foundation recruited internationally known businessman and philanthropist John D. Evans to serve as chair of the commission. And through the John D. Evans Foundation, John and his partner, Steve Wozencraft, have supported LGBTQ plus causes since its inception. Members of the commission range from a resident physician to retired professionals, and as you can see on your screen, encompass a diverse group of races, genders, members of the community, and more. And in an effort to remain transparent, we have linked our commission members throughout our website and within our application portal. We've asked our commission members in reviewing applications that if they note a conflict of interest with an applying institution, that they recuse themselves from reviewing and scoring the submitted LOI or RFP to ensure a fair and transparent review process. I will now turn the floor over to Dr. David Brown, a commission member from the University of Michigan, Michigan Medicine, to go over what exactly the commission is looking for in cycle 2.
Thank you, Faith. For cycle 2 of the fellowship, the commission is looking to select an institution whose proposal is broad-based with a multidisciplinary approach to training its fellows and leadership, sustainable and is able to continue the initiative after completion of grant funding, offers didactic and experiential training for its fellows, incorporates institutional integrations, and has buy-in from the top down, addresses intersectionality and marginalized populations within the LGBTQ plus community, and shows its program will be a force multiplier with impact on the fellows, institutional leaders, undergraduate and graduate medical students, community partners, and others. On your screen, you will see the categories in which your application will be scored by the commission. They are LGBTQ plus experience, program objectives and fellowship benefits, institutional integration and organizational partners, project plan and budget, sustainability and expansion, and overall impression. I will now turn it back over to Faith to go over the logistics of cycle 2 applications.
Thank you, Dr. Brown. So the fellowship application process is threefold. it begins with the open call for letters of intent, which is the where we are currently at within the application process. So the call for letters of intent is open to all interested and eligible institutions. This is the first initial screening of applicants. The second step is by invitation. The foundation, with the recommendation from the commission, will invite select institutions to submit a more detailed proposal, the request for proposal or RFP. The final step will be interviews with top institutions. This will also be by invitation and with members of the commission and AMAF program staff. These will be hosted in early May, and these institutions will be selected by the commission. The commission will then develop their recommendation for the Cycle 2 grant recipient and submit it to the AMAF board for final approval. And so on your screen is the timeline for Cycle 2 of the fellowship program. Some key dates to note, so LOIs are due at midnight Central Time on January 3rd, 2022. Select institutions will be invited in early February and will have until April to submit a more detailed proposal, the RFP. Interviews with AMAF staff and the commission will occur in early May, and then the Cycle 2 awardee will be announced in June of 2022. As a note, AMAF staff will notify your institution of its status at the end of each stage of the application, whether or not you have advanced or not. And so after this meeting, I will send out an email to everyone on the call and everyone who's been invited with a link to this video recording, as well as the PowerPoint and links to our application portal. So you will have all of this information at your disposal. I will also post the video to the application portal itself for your reference. And if you have any additional questions, feel free to reach out to either Sandy or I. Our emails are on the screen. They will also be included in the follow-up email. But now we will open up the floor for questions and answers. And if you could please use the raise hand feature below, I can help moderate, or you're also welcome to submit your questions within the chat feature.
And while you are thinking of your questions, I'm just going to open it up to see if any other commission members wanted to add any other additional information, and then we're happy to take your questions.
Sandy, while they are thinking, I would like to just interject that our youngest, wish it were me, but our youngest commission member, Bianca Jenkins, is a trainee. And we have just reveled in her commitment, in her engagement, and what she contributes to the ideas for the fellowship and its implementation. So it's a critical point that we are all at when it comes to our responsibility in training our future professionals. Thank you.
Thank you. So if we don't have any additional commentary from our commission members, which I do not see any hands raised from members, I will go ahead and get started. I see that Dan Reardon has his hand raised. Dan?
Yeah, thanks so much for the invitation. I'm Dan Reardon from the University of Colorado School of Medicine. I had maybe 2 or 3 questions. So we actually sent in an LOI last year, but I don't think we got any feedback on our proposal. Is that possible? And I guess the other questions I have is, how many institutions are you looking to fund? And then is this going to be will this fellowship actually be an ACGME accredited fellowship?
Well, I'll pop in, but then for all these questions, I encourage our commission members to answer. In terms of personalized feedback, we will do our very best to provide input on the scores you received from the last round as we developed this LGBTQ plus fellowship last year. One of our commission members put it best that we were designing the plane on the runway. And so, we were still working out the kinks of how we would best provide feedback. But if you send us an email, we can give you just some general feedback on where you scored high or where you scored low, but really focus on the information that was presented to you here today in terms of what the focus is for cycle 2. But I'll let the commission jump in on his other questions.
As part of reviewing the applications, each of us had the opportunity to review all of the initial applications and then some of the final ones to winnow it down. And along the way, we made a series of comments of strengths and weaknesses. And so I think that that's the information that may be most helpful to you. And the fact that anybody applied before and wasn't chosen should not be a deterrent. We could only choose one. And we had an incredibly difficult time winnowing it down.
And to answer the ACGME question, it's not an ACGME fellowship at this point.
And I believe your last.
Having started a med peds training program here, that's a whole lot of bureaucracy.
And I believe your last question was how many institutions are we looking to fund? At this point, we're looking to fund 1 institution per year. We hope in the future we'll be able to fund more.
We're waiting for the windfall.
We have a couple questions that have come through in the chat. I think this is a great one for one of our commission members. Can you further define broad-based multidisciplinary? Perhaps Dr. Cohen or Dr. Brown? Multidisciplinary?
Sandy, I'll start and then I'll let them edit, subtract, add, and correct anything I say. But in fact, we have seen very focused applications on one element of care. And at least at the beginning, the reason for this terminology, broad-based, there are so many aspects to care to be considered that regardless of the department designing the curriculum or acting as official sponsor and PI of the fellowship, we do feel it important to have the many different aspects of care addressed. So for example, there was another question in the chat about including or not including statements of letters and support from community partners. And yes, and that's part of the broad base, so that there are behavioral aspects that are critical to this care. Now, fasten your seatbelts. I told you I was a radiologist, okay? There are radiological aspects to this care in terms of access to screening, in terms of appropriate screening for trans populations, and in terms of the correct interpretation of imaging findings in patients who have undergone gender-affirming surgery. These are not abscesses, these are not collections, and these are not masses. So I think that while not every application has to read, family medicine approach to this, we do think it's important to address a broad base of issues. I welcome other comments from commission members. Thank you.
In addition to what Dr. Bello said, one of the things that can be highlighted is the intersectionality with other identities and other marginalized identities as well. So that's something to consider.
One of the other points that we considered was the breadth of care. In other words, avoidance of, or I should say, inclusion of the entire range of patients from adolescent through the geriatric population is one thing. The other are things that are not strictly clinical, but are advocacy in such things as the laws that govern a specific area, including all of these activities in one. So these are the other aspects of the broadness, that this involves perhaps a law school, perhaps involves a nursing school, perhaps involves pharmaceutical, any of the other aspects of, if you will, medical education and healthcare delivery.
And I'll just finish up by saying, part of the goal here is to collect data and eventually develop these standards of care. And in order to do that, we wanted to make sure for at least these first few cycles that we could compare apples to apples. And down the line, depending on the success of the fellowship and the funds available, start funding specialty or subgroup populations within the LGBTQ Fellowship. Very specific fellowships aimed at different things. And so that is the ultimate goal, but for right now, focusing on more of a broad-based approach. Our next hand up, Anu Hajra. I apologize if I said your name incorrectly.
No, Sandy, that's fine. My name's Anu. Hi, everyone. Thank you so much for hosting this, and thank you so much for putting the resources and investment into this fellowship. We really do appreciate it. I'm from the University of Chicago. I guess my question is, how much is geography being taken into account in selecting the awardees? As a Midwest institution, we know that the first awardee was in the Midwest as well. So we're a little apprehensive of whether our application would be looked the same way as potentially another geographic limited area like the Deep South that definitely needs this type of work too.
Any commission member want to take that on? It's a tough question.
I mean, I'll kick it off by saying, I don't think we're going to limit it to any specific geographic area. We want to be able to support an institution that is able to accomplish the goals that were laid out. So, I think we would even consider, another program even in the same state if they had, the ability to accomplish the goals in a really effective way. So, we did discuss a little bit about geography when we went through the first cycle, but ultimately it was not, it did not contribute to our decision-making process substantially. It really was much more about the program that the institutions were able to put together and the impact that we thought it would have both on the LGBTQ plus community that institution served, but also on the institution itself.
Yeah, and I like to chime in as well. It was really important that we had a fair and equitable process, that the best application received the award. And there were many great applications, so it's hard to determine what was the best. However, there's many different components to the application, and if people, institutions in certain areas can strongly tie, the disparities in their areas, that could that can enhance their application. It doesn't mean that that would make it the best per se, but utilizing all the strengths that your institution and your location has is really important for creating an amazing application.
One of the other things we looked at was the support from the leadership at the institution, that this has to be a top-down support. And along with that is the notion of sustainability, and that this is not a one and done type situation. It is to establish a program that is going to be able to replicate itself in the years to come.
And maybe I'll clean up on this question and say that without trying to sound dismissive of the question or the concern, if you consider the overarching goal to ultimately build a consortium and build a repository of best practices, really it shouldn't matter where any one awarded institution is, because the AMA Central has a track record going back to 2013 in transforming medical education, where they used just that recipe. Now, with deeper pockets than we have, they granted initially in 2013, 11 schools to transform medical student education, and quickly added on administrative grants to other programs. When I say administrative, so the original grants were for $1 million each, but for $75,000 each to additional schools, you could have an administrative staff person be able to plug into this repository. And then jumping ahead to, if I think it's a year ago, it's probably at least 2, they undertook graduate medical education with their reimagining residency program. And similarly, these were bigger grants, so they granted fewer of them, $1.8 million to some 8 programs, and then they added 3 more. But again, the idea is to form this consortium and a central repository. And it's because of that, and again, I don't want to sound glib, but we can almost afford to be agnostic as to exact geographic location if we are all working toward this overarching goal. Thank you.
Thank you. I really appreciate the responses. Thank you so much.
Thank you. We did have a question in the chat that Faith answered with our updated link. So for those of you who applied last year, you will notice that the application portal is different. We realized about halfway through that we needed a much more sophisticated system to handle the fellowship program rather than some of our scholarship awards. And so we do have a new portal. The LOI, the letter of intent itself, is basically the same. Some questions had some wording changes to provide more clarification, as well as a bit of streamlining, so there wasn't as much redundancy between the LOI and the formal application. Plus, we kind of reiterated some questions that were farther along in the application that the commission felt were important to address in the first stage of the application process. But anyone who did submit an LOI last year, we have your applications, and if you need us to send it back to you, we are happy to do so, so that you don't have to start over again. Are there other questions? And if you're shy and would like to email us privately, you're happy to do that as well.
Hi, I wanted to ask a question, please.
Sure, please.
I wanted to share this with my staff who wasn't able to attend right now, but she's going to be pioneering the application. Can I have access to this recording?
Absolutely. Faith will be sending out the recording and the slides afterwards, so you have access to all of the information.
Okay, so because I registered with my email, I'll receive it. Thank you so much for all your information. I appreciate all of you.
Not a problem. We appreciate your application. Other questions? Other commission members want to add feedback based on the discussions throughout the LOI and RFP process? All right. I will give you one last chance to raise your hand or pipe in to ask a question. We don't want to cut you off, but we don't want you to have you sit here with no additional information either. But I'll invite our commission members to provide some closing remarks if you'd like to do so.
Do commission members want, oh, I see a hand up. Wait a minute. John and Candela.
It's just an applause of thanks.
Oh, it's an applause. It's not a hand up. Now,
Thank you
now,
for the-
now
thanks
you
for
know
the
why I called attention to it, right?
Yes.
But we haven't heard from some of the commission members. And again, this is no pressure, but anyone who would like to add anything before closing? While you're thinking, I just want to emphasize two things. Number one, Joshua Cohen and the tremendous effort in organizing the first cadre of founding donors to the seed that planted, this is the seed that was planted for developing this fellowship. And secondly, to our fellow commission members, when Sandy spoke about going to another platform, it was clear from the get-go that this was a deep dive. This is hard work. And rather than whining and asking for help, they asked for more time to more seriously consider the applications. So my kudos to my fellow commission members. And it really is a task, but it is also a labor of love, love for a principle. And then, of course, I need to thank our foundation staff. Faith, who has quite literally not only carried the flag, but make sure that our background flag gets sent to anyone who needs it on the fly. Sandy, who I think, I don't want to speak out of turn, but Sandy, if this isn't your first RFP that you had to author, it's probably your first award-winning one. And then, of course, our program person, Emily, who really connects all of the dots all of the time. They are under the leadership of Barclay Payne, who is a champion for this cause. And I'll stop if anyone else has anything else to add, but really, and to all of you for your interest, thank you.
I will just add, Dr. Bello, and first of all, I echo everything you said. As a commission member who is not a medical professional, I will say, and I know that my fellow commissioners feel the same way, I was really taken aback by the care and thoughtfulness of the applications. It was clear that folks were really, really putting their best foot forward in trying to think of ways to create programs and not silos. And so I'm really, really looking forward to this second cycle and really appreciate your interest by spending your time here and look forward to reading your applications.
Well, thank you again, everyone. We're so glad to host you here today. And again, if you have any other follow-up questions or want to have a conversation, just reach out to myself or Faith and we'll be happy to do that. And we wish you the best of luck on the application process. Have a wonderful day.
Thank you, everyone. Bye.
Stay healthy.